Bismillahirrahmanirrahim. I am Dr. Ahmad Zishan and this is a repeated video on a chest X-ray basics. Starting from here, this is the airway, which is also known as trachea, and it is always central in position. Behind these white are vertebral bodies. These are thoracic vertebra up to here. So this is the trachea, main trachea, right bronchus, left bronchus, and this is the right clavicle, left clavicle. These are the anterior ribs, fourth one, fifth, sixth, and these are the posterior ribs, first, second, third, fourth, fifth, sixth, seventh and eighth. Similarly on this side, first anterior rib, second, third, fourth and fifth and sixth. This is the posterior, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the scapula. This is its medial border and lateral border. Similarly here, this is the medial border and the lateral border. Moving forward, discussing about the heart, this is the right heart border and this is the left heart border. Right heart border has this here superior vena cava impression, right atrium and right ventricle. On this side, this is aortic knuckle, here pulmonary canthus and the left ventricle. At the level of third anterior rib, first, second and third, here, this is the hilum of the lung, right lung, and first, second and third, this is the hilum of left lung. This impression on the X-ray is showing pulmonary vessels. At the hilum there are pulmonary vessels. This is the right diaphragm. Diaphragm is usually dome shaped. This is the left diaphragm. Below here, this is the stomach, and this is cardiophrenic angle, this is costophrenic angle. Similarly on the left side, cardiophrenic angle and costophrenic angle. So this here, it is the trachea. It is pushed towards the opposite side if here it is having pneumothorax or pleural effusion, and it is pulled towards the same side if there is fibrosis or any mass lesion. So this was basically a chest X-ray PA view. Sometimes here there is a accessory rib, which is known as accessory cervical rib, or it can be here perpendicular to the normal axis of the ribs. So this is another chest X-ray, and here you can see there is some lesion. This is the trachea, and this is the heart, a bit rotated film, and here you can appreciate a small thin line over here. This is a small line which is this opacity is attached to the hilum, so any opacity which is attached to the hilum must be considered as a lung mass. This is another chest X-ray, and it is this is the left side, this is the right side, and as I have told in this video, in the same video, if there is element of fibrosis, the trachea will be purged towards the side of fibrosis. Here you can see the trachea is on the right side, and there is hyperinflation on the left side. There are small, very shiny spots. These are known as post-TB calcifications, and there are small cystic shadows which shows cystic bronchiectasis. Here the trachea is pulled towards the right side. Here you can see an air fluid level. This is also air fluid level. Multiple air fluid levels are seen here, and this is basically a destroyed lung due to tuberculosis. There might be some effusion here, and this is one hydropneumothorax, This is second hydropneumothorax. This is a large air containing space, and below it there is a level and some element of effusion. So this small hair fluid level, this can be a lung abscess. So in this overall scenario, this is a right side destroyed lung as compared to this left one, and this is sequel post TB sequelae. In this patient we have to rule out first of all MDR. On the left side there is compensatory hyperinflation. You can see when we normally 6 anterior rib is crossing the mid of diaphragm. Here 1, 2, 3, 4, 5, 6 and 7. 7th rib is crossing the diaphragm, which shows hyperinflation. You may not appreciate the ribs properly as there is increased reticular shadowing and post-TB calcifications on the left side, and mediastinum is pushed towards the right side. So this X-ray is showing post-TB sequelae and left-sided compensatory hyperinflation. Here are the pulmonary vessels, so patient may have pulmonary hypertension as well.